natural defect.
Right. Next, fencing reflex. Again, if you turn the baby's head, the baby does a bit of a fencing action. Okay. So nobody actually knows why that is there, but that's to do with coordination. Then the stepping reflex is another nice reflex that you can play around with your newborn, where in case when you place the baby's feet on a surface, the baby will start taking some stepping action. Okay, so we take some steps. So that's called the stepping reflex, and that disappears usually by two months. So next, lastly, is this reflex called the tongue thrust reflex. Have you heard of that reflex? Anybody? So if you touch the baby's lips, the baby will stick out its tongue. So I mean, mothers tend to do that just to check if the baby is hungry, but that's not the right thing to do to check if the baby is hungry. But the reason why they have that reflex action is to prevent from choking, right? So it's a built-in system. Isn't it amazing? Again, I keep saying that baby's being designed like that so that the baby can protect himself from choking. So if there's a foreign object going into the mouth, the baby will stick its tongue out and prevent him or herself from choking. That disappears by about 6 months, okay? Now, why is that important that it disappears by 6 months? Anybody?
Winning.
Very good, well done. So that's when we start giving solids, right? So imagine if you've got that reflex and you're trying to stick a spoon into that baby's mouth and out it comes, right? So once that reflex disappears, the baby is ready to receive solids. Is that clear? Yeah? So that's the tongue thrust reflex, and it's an amazing reflex. Okay? Right. Tummy time. Gosh, I've been speaking too fast, but I'm trying to stick to time because I know it's before your lunch break, so everybody's keen to have lunch.
I use the company this Wi-Fi.
So, tummy time. Have you heard of tummy time? So, I mean, if there's nothing that you've taken away from this lecture, the most important thing is this, okay? So, just this one thing, if you take this one message home, that I've done my job, okay? So, tummy time is very important. Now, babies should be sleeping on their backs. Now, the hospitals in Sri Lanka will tell you about putting them to sleep on their sides and all sorts. That's all absolute nonsense as far as I'm concerned. Babies should be sleeping on their backs. You've heard about hot death and sudden death. So a risk factor is putting the babies to sleep on their tummies and on their sides and all sorts. Babies should be sleeping on their backs. So as a result, what tends to happen is that one side of the head gets flat more than the other. So I don't know if you can appreciate that on this picture. This baby's one side is flat more than the other. So then they develop a preference. They keep turning to that side. That makes it even flatter. So it's a bit of a vicious cycle. So you get lopsided baby's head. You may have seen that, nieces, nephews, other babies, where the head the ear gets pushed forward. Okay? So that's called bhfyp. And in order to prevent that from happening, we need to go back to doing tummy time. Okay? So tummy time is very, very important. I talk about this at the 2-week checkup. So from 2 weeks onwards, we need to start doing tummy time. So you can see that this is a very early baby, where you rolled up a sheet because the baby's face gets sort of buried in the surface and you might find it difficult to breathe. So you can roll up a sheet and give a bit of a gap between the surface and the baby's face. Preferably a hard surface like the table or the floor with a soft play mat is useful. So that's tummy time, and this is an older baby having tummy time. Okay? So very important. Initially, a couple of minutes. Babies don't like tummy time. Okay? They never like what is good for them, so they don't like tummy time. So initially they'll try after a couple of minutes. Every day you just push them back a bit further and build it up to about 10 minutes. Alright? So that's tummy time, and that's very important. Vision. Right, so I get asked about, what can my baby see, doc? Can they see me now? When can they see properly, and all sorts of questions about vision. So that's why I put this slide, so I'll just run through it very quickly. At birth, their vision is very, very fuzzy. They can just about sort of make out light and day. They can differentiate between sort of black and white. That's why you can see these newborn toys with these black and white circles and things like that. So that's because that's what they can see initially. As they get older, their vision gets clearer, and they can sort of see better. They start fixing and following at the age of 2 months or so. So when you come for the 2-month checkup, that's one of the things that I ask, whether your baby is looking at you and following you, and they smile at you. So at 4 months, they get depth perception. They can tell you how far things are. 5 months, they get better with their vision. They can recognize sort of parts of objects. Then at 8 months, they can see across the room. So that's when they start getting excited when they see daddy coming home, and their vision is much more mature at that stage. By 9 months, it becomes very, very sharp, and then you have to worry about the little crumbs that you have in your house, and worry about little objects and things, because they tend to pick on things and generally tends to go in their mouth. Okay, so they also begin to point at objects, and they sort of ask for things. By 12 months, they can tell the difference between near and far. So after 12 months, their vision is generally mature like yours and mine. All right. So little basic on immunization. Just that before the baby leaves, the baby gets their BCG. It's slightly different to the normal other vaccines, which is usually intramuscular, into the muscle. The BCG is given into the skin, where you get a little nipple-like thing forming, and by about 6 weeks, you get this scar that you're all familiar with. If you look at your left arm, you can see a scar, and that's the BCG scar that we give to our babies, and the babies get their BCG before they leave the hospital, usually, unless they're ill or in an ICU. Right. So, this is a slide that I put earlier on, but most of you have all these apps and things. So the baby center app, I prefer and I like, because some of my colleagues in the UK, they're the ones who sort of created it and work really well. So, I've sort of left some room for questions. Any burning questions? No questions? Don't feel shy, everybody's in the same boat. Most of you are from back here actually.
Let's ask it.
Thank you so much, Doctor, for your valuable information. And when do we need to do the tummy time?
So, you can do it from the newborn period, from day 1. But I generally start at 2 weeks. So when you come to the 2-week checkup, I talk about it and start tummy time. As to when you do it during the day, when the baby is awake. So the baby should, as I said, always sleep on their backs. And when they're awake and in a playful mood, do the tummy time. And it helps improve the neck muscles and it helps with the head shape.
You told us something about babies being tongue-tied, and how that affects feeding
So,
the early days.
So tongue-tie, the question is about tongue-tie. Are you all familiar with tongue-tie? So, if you just look at your neighbor or your husband or your wife, you can see that they've all got a little frenulum, right? And usually it's right at the back. In some babies, it can be quite far forward, and that anchors their tongue down. And when they try to stick their tongue out, they form a little heart shape. Okay? And that can affect breastfeeding. So the mothers might have painful cracked nipples, and that's called a tongue tie. That is what you. So I take it if there are problems with the feeding, and that's the only reason I do that. there's problems with breastfeeding. Babies with tongue ties don't have any problem with bottle feeding. They can have problems with breastfeeding.
How do you figure out if the baby is not feeding properly because of that in the early days at least?
So, I mean, you go through the process, so the mother will complain that the baby is not feeding well, the baby is not latching properly, mother is having crackling moves. So, if there's a tongue tie identified, you can address it. That's it? Alright? So, having said all of this is not to frighten you, but just to arm you with this information so that when your baby is born, when these little things happen, you will not, then you will be aware of these things. So it was just for awareness, okay? Not to frighten you. So all the best, all right? I'd like to also mention at this point, I always make it a point not to give your babies, newborns, honey. Okay, that tends to be a custom. The ruling is that we should be giving the date for those who do that particular practice, not honey. Okay, honey should not be used until 1 year of age.
Yes, I also have another question. I don't have kids and babies, but still I have seen a lot of parents like after they breastfeed, they keep the baby to let the birth go. Sometimes it takes a while. So if the birth doesn't come, what's the then is there?
I know burping is completely overrated. People spend too much time and effort with burping and thinking about burping. Okay, so you just spend a bit of time burping, like you said, 5-10 minutes. If the baby burps, they burp. Otherwise, just put them down. Same goes with this whole concern about vomiting and aspiration. The hospitals will talk about putting the babies to sleep on their side if they haven't slept. So that's all exaggerated concern about aspiration and choking and babies having lots of problems not being burped. Again, stems from this burping issue. So burping is completely overrated as far as I'm concerned. You attempt to burp the baby burps, they burp, otherwise just put the baby down.
Okay, so thank you very much. Actually, these are indeed common problems that we are facing because